Good morning, everyone, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Chief Darren Rizzi from Mississauga's Fire and Emergency Management Services, and this week, I'm joined by a very special guest, the Honourable Omar Al-Gabra, Federal Minister of Transport and MP for Mississauga-Erindale. There have been some significant announcements over the last few weeks concerning travel and the opening of our borders. So I've invited Minister Al-Gabra here today to provide us with a little more details about these changes and what they may mean for Mississauga residents. Before I give my COVID update, I just want to welcome the members of the Cat Lake First Nation who arrived in Mississauga. Due to the wildfires in Northern Ontario, several Indigenous communities have been evacuated, including some members of the Cat Lake First Nation. I realize this is a very difficult time for those who have had to evacuate, but I want you to know that we feel honored and privileged to have you stay in our community until you are able to return to your home. I want you to know that Mississauga is a caring and welcoming city where we celebrate residents from all backgrounds. The evacuation of members of the Cat Lake First Nation is being coordinated by Emergency Management Ontario in conjunction with federal, provincial, and First Nation partners. And Mississauga City staff are working closely with the province to explore reserving space within our community centres for on-site recreational activities, the need for the provision of recreation kits, as well as some planning other activities such as bus excursions for them. I can only imagine how difficult this must be for our Cat Lake First Nation community members, having to leave their home in such a precarious state and having to come to such an unfamiliar place. But I want all Cat Lake First Nation members to know that you have the full support of city staff in the City of Mississauga and my office, and we will do everything we can to support you. And now for my COVID update. Mississauga, we are in a very enviable position right now, not only compared to other provinces across Canada, but in jurisdictions around the world. We have made enormous progress week after week after week in getting our COVID case counts down. We also continue to make huge strides in our vaccine rollout. We're just about a week into step 3, and I'm thrilled to report that once again, our COVID indices are trending downwards. Peel Region is averaging 5.5 cases per 100,000, and that's down from 10 cases per 100,000 last week. Mississauga is averaging 3.9 cases per 100,000, and that too is down from 7 last week. Peel's reproductive factor, the single most important indicator of community transmission, sits at 0.75, with Mississauga slightly lower at 0.7. It wasn't long ago that our R factor was above 1, meaning that for every person in Peel who caught COVID, at least one other person would be infected. Today, the risk of rampant community transmission remains very low. The situation in our hospitals continues to be stable, with 8 COVID hospitalizations at Trillium Health Partners and only 1 person in the ICU. The situation is similar at Brampton's William Osler Hospital, with 5 COVID hospitalizations and again, only 1 person in the ICU. And on the vaccine front, I simply couldn't be more thankful and grateful for the way that the community has stepped up to get their shots. In Peel, we have now administered more than 2 million vaccines. It's nearly 80% of residents in Peel, 12 plus, have received 1 dose, and close to 60% have received 2 doses. Just let that sink in for a minute. And if we rewind to just 2 months ago, we had only a fraction of our population with 2 doses, and we were fighting to get more vaccine here into Peel Region. So I truly can't underscore enough just how far we've come over the last little while. I want to again thank everyone who has stepped up to get their vaccine. It is because of your efforts to protect your family, your friends, your neighbors, and the entire community that we have stabilized the situation at our hospitals and now able to see more and more reopenings. Thank you, thank you, thank you. And to those who still haven't received their first or second dose, there is still time. Please consult with a friend or your family physician on what's appropriate for you. Peel Public Health has thousands of appointments available at our mass vaccination centers, so please don't hesitate to book your appointment. The easiest way to book your vaccination is by visiting the online provincial booking system or by calling 1-833-943-3900. Broad second dose coverage is what will help ensure that we don't see a spike in cases and will protect the significant gains that we have made. As Dr. Fauci, the chief medical advisor to President Biden, has astutely said, this has become a pandemic of the unvaccinated. And now I want to talk a little bit about a new report that Ontario's Science Advisory Table has released earlier this week, along with the province's pediatric hospital. The report recommends that schools across Ontario return to in-class learning in the fall, with sports and clubs, no lineups at the doors for daily health checks, and optional masking as long as there isn't a spike in severe COVID cases. The authors of this report also recommend that students stay home when they're sick. Sounds logical. Improvements are made to the HVAC systems in schools, that the windows are opened as much as possible, that air purifiers are installed in classrooms, and that teachers teach outdoors whenever that's possible. I agree with the advice from the Science Table, and I strongly encourage the Ontario government to do everything in its power to ensure that we don't see a repeat of last year. Our students need in-class learning. This is not only essential to how they learn, but also for their social development and for their overall well-being. They need sports and clubs, and they need to be around their friends, their classmates, and their teachers. Importantly, the report also encourages students aged 12 to 17 to go out and get vaccinated. And if you do the math, in order for our youth to be fully vaccinated by the first day of school, they will have to have had their second dose no later than August 24th to allow for the 2-week period for the vaccine to kick in. That's why I'm so happy that Peel Public Health is now making it easier for Peel youth 12 to 17 to get their vaccine. As part of our Vax to School campaign, youth aged 12 to 17 and their families can simply walk into any of our mass vaccination centers today, show proof of age, and skip to the front of the line. Youth will receive the Pfizer vaccine, as this is the only vaccine approved for youth at this time. Youth can also book an appointment at any mass vaccination clinic by visiting Peel Public Health's website at peelregion.ca/COVID-19 vaccine. This fast-track option is available for the rest of today at our mass vaccination centers, so please go out and take advantage of this great opportunity. As part of our Vax to School campaign, we've also included a number of dates at our clinics with youth-focused appointments. For dates and times, please visit peelregion.ca/COVID-19 vaccine and look for the pop-up clinic drop at the menu on top. I encourage all of our youth and their families to get out there and to get their shots. As I mentioned last week, Peel Public Health has already begun transitioning resources away from our mass vaccination clinics to focus on targeting those areas in our communities who haven't yet received their shots. And I want to begin by being very clear that this is a good news story, and it shows that our mass vaccination clinics have done their job, getting the majority of our people vaccinated. On July 26th, the mass vaccination clinic at the International Centre will close. The following day, Trillium's UTM clinic will also close. Peel Public Health will provide updates in the coming weeks on when our other mass vaccination clinics are expected to cease their operations. Peel Public Health has identified several areas in the region with lower vaccine uptake than others, and more resources are being deployed to these areas so that we can ensure everyone has easy access to the vaccine. We can now look at this period as the home stretch of our initial vaccine rollout to get to that final 10 to 20% of our population and ensure that they too are vaccinated. It includes close collaboration with primary care offices and pharmacies in targeted areas, small pop-up clinics with priority bookings, and the continuation of homebound vaccinations through drive-through clinics. It is so critical at this point that we do everything we can to make the vaccine accessible to everyone in Mississauga, particularly our most vulnerable and those from racialized or marginalized communities. The progress that we have made over the last few months is outstanding, and I'm thrilled that we are now in step 3 and have seen more and more reopenings over the last week. Please, get out there and support our local businesses, especially our local restaurants, personal care providers, and retailers. They need our support now, right now, to ensure that they not only survive, but that they thrive. I do, however, encourage residents to continue to remain vigilant. Please continue to wear your masks in all indoor public spaces. If you have COVID symptoms, even if you're fully vaccinated, please go and get tested and self-isolate while you're awaiting those results. With the loosening of restrictions comes great individual and collective responsibility. And it's up to all of us right now in this moment to do everything in our power to protect the significant gains that we have made. I'm excited for all of our residents that we are now doing more of the things that are essential to our health and to our well-being. I'm excited that our business owners have now opened their doors to more customers. But I really can't say this enough. Please remain vigilant. We saw these similar numbers last year, and we had a second and then third wave, but of course, we didn't have the vaccine then. Please be careful. Continue to follow the guidelines of Peel Public Health. And if you haven't booked your first or your second dose, please do so as soon as you can. Before I invite Dr. Lowe to come up for his update, I just want to quickly mention that yesterday I took part in the National Summit on Anti-Semitism, and today I will be taking part in the National Summit on Islamophobia. Sadly, we have seen a rise in both anti-Semitism and Islamophobia in recent months, including the terrorist attack in London, Ontario, that killed 4 members of in the Muslim community. I believe that Jewish and Muslim communities across Canada need more from their leaders than proclamations condemning hatred and bigotry. What I believe they want and what they need is all levels of government, law enforcement, and community groups to come together to develop concrete and tangible strategies that effect change. And both these summits are very important steps in that direction. In Mississauga, we are taking steps to address bigotry and hatred. But we know that more needs to be done. I'll be taking some of what I learned from these summits and apply them to the work that we are doing here with our community stakeholders to end anti-Semitism and anti-Muslim hatred in our city. Mississauga, this is my last scheduled press conference for this summer. If there are any major developments, I will certainly call another press conference to provide our residents with the information that they need to know. We started these press conferences in an effort to better communicate with our residents and to provide certainty and clarity during an incredibly challenging, fast-moving, and evolving situation. And I really hope that we accomplish that. For now, I will be providing regular updates through social media over the coming weeks, and the City of Mississauga will be providing online updates as well. We will return to scheduled press conferences later in the fall. I would like to take this opportunity to once again thank everyone in Mississauga for doing everything that they've had to do to protect and support our community. From listening to the advice of public health, to donating food, donating funds and PPE, donating funds for our food bank and for PPE to our hospitals, to coming together to organize a vaccine rollout that will go down as one of the greatest collective undertakings in the history of this city and region. I am so grateful to Dr. Lowe, Peel Public Health, our frontline healthcare workers, our essential factory workers, our community organizations, our businesses, resident associations, our BIAs, our paramedics, our firefighters, our police officers, and our volunteers for working hand in hand to get our community vaccinated and keeping us all safe. I am humbled and honored to be the mayor of such a compassionate and caring city. I wish everyone a great rest of the summer, and please do not hesitate to reach out to my office if you have any questions or need any support. And you can always reach me at mayor@mississauga.ca. I'd like to also give a special hello to Chloe. Hey, Chloe. And now I would like to invite Dr. Lowe to the podium to provide his update. Thank you.
Thank you, Madam Mayor, and good morning. Good morning, Minister Algebra, and good morning, Mississauga and Peel residents. We are now almost a week into step 3. Our trends continue to remain favorable in Mississauga at 3.9 cases per 100,000 and a 0.6% test positivity. Our vaccine coverage also continues to grow with nearly 80% of our 12-plus population with a first dose and nearly 60% of our 12-plus residents with a complete 2-dose series. I want to thank all of our residents who have gotten 2 doses so quickly using all available supplies. Your collective efforts have now become our best defense against COVID-19. I also want to urge other residents who may remain on the fence, who may be uncertain, to please get protected as quickly as possible using whatever vaccines are available. That's because we know that COVID has been a thief. COVID has taken lives, and it would have taken so many more lives if it weren't for the collective actions and sacrifices of our frontline heroes, our businesses, and each and every single one of us. It has also taken time. It has taken time keeping us apart from our loved ones and putting our plans on hold. We know we can't ever change what's been and gone, but by closing down, staying home, and staying apart, we limited transmission and gave our hospitals and frontline providers a fighting chance to keep our most vulnerable safe. Thank you. Looking out for each other, we have brought together with us many more residents through this crisis into a brighter day. We have given ourselves now the chance to reconnect and restore our lives together. But we know we cannot let our guard down. We know that a resurgence is very likely in the fall, and that's why we should do everything we can to ensure that we don't give COVID another inch. We're done with COVID, stealing things that matter from us. We never want to go back. And the surest way to do that is through getting 2 doses of vaccine. Because before we had vaccines, we had to stay apart to keep each other safe. That's how we used to take care of each other in our community. But now we have vaccines that are safe and effective, and we can take care of each other by doing our part and getting vaccinated. If you've already done your part to get to 2 doses, thank you. If you're still waiting, know that 2 doses protects you from severe illness, hospitalization, and death. It protects your loved ones from spread, and it protects all of us from having to ever use broad closures again to fight a resurgence. Right now, the vast majority of individuals being hospitalized and facing death are the unvaccinated. Continued susceptibility means that a surge requiring measures that threatens lives and our hospitals may well be a possibility. So I'm asking each of our residents to please do your part and get vaccinated with 2 doses so that we can take things back from COVID, which has already taken lives and so many things from us. If you have questions, by all means ask. Talk to your family, your friends, your physician about their vaccine experience and their vaccine expertise. Visit peelregion.ca/COVID-19 vaccine to learn more about the vaccines and then book your appointment. Today, youth 12 to 17 can skip to the front of the line with proof of age as part of our Vax to School effort. And tomorrow is Pfizer Friday, and we can't wait to see you. This has been the longest emergency response undertaken by Peel Public Health since the founding of the region of Peel. Through it all, I've long considered what I might say at the conclusion of our regularly scheduled media briefings. With today being that day here in Mississauga, I want to say the following. Thank you to our regional council, our hospital partners, our provincial partners, and our community partners for your unwavering support and partnership throughout this response. Thank you to Peel residents, businesses, and fellow Canadians for trusting science and for looking out for each other. I've been inspired by our collective work and sacrifices and our willingness to keep each other safe through staying apart and following precautions at first, and then now in getting vaccinated. Because you see, getting vaccinated is a simple act that protects you and looks out for your neighbor, and that's incredibly Canadian. By getting our shots, we are showing that we care for each other, especially our most vulnerable. Our current efforts have grown such that we now have the chance to become some of the most protected communities and one of the most protected nations on earth. And even though we'll likely see a resurgence in the future, widespread vaccine coverage will mean that the specter of COVID will hold far less sway in better days ahead. We got through this by looking out for each other. And regardless of what happens next, I know that the Peel community will rise to the occasion. So again, to conclude, deepest thanks. Stay safe, stay vigilant, and get vaccinated. For the moment, I'll pass it back to Mayor Crombie. Thank you.
Thank you, Dr. Lowe. Earlier this week, the Government of Canada announced that starting on August 9th, fully vaccinated U.S. citizens and permanent residents living in that country will be able to visit Canada without having to quarantine for 2 weeks. The federal government then plans to open Canada's borders to fully vaccinated travelers from all other countries on September 7th. This is a pretty significant step forward for our travel, our tourism, our hospitality, and our airline industries, as well as for our residents with family and friends living in the U.S. or abroad. And so to provide a little update on this and more detailed information, as well as other travel guidelines for Canadians, it's my absolute pleasure to welcome the Honourable Omar Al-Gabra, Federal Minister of Transportation and Member of Parliament for Mississauga-Arundel. Minister, the floor is yours.
Thank you very much, Mayor Crombie. It is a pleasure to be with you here this morning. Hello, everyone. Bonjour à tous. Let me just say that I'm speaking with you today as I am traveling across the province, making government announcements, but I wanted to join you this morning, Mayor Crombie, to share some of the good news that you've just outlined. Over the past 18 months, it has been really difficult for everyone. I know how challenging things have been and how hard Canadians are working to keep themselves and their loved ones safe. Thanks to this positive progress that you and Dr. Lowe have been outlining, we can now start easing border measures for fully vaccinated travelers. On September 7th, we intend to ease border measures to allow entry for fully vaccinated travelers from any country for non-essential travel. Ahead of that date, on August 9th, a number of important changes at the border will come into effect to allow fully vaccinated U.S. citizens and U.S. permanent residents who are currently residing in the United States to enter Canada for non-essential purposes. Also, on August 9th, the 3-night government-authorized hotel stay requirement will be eliminated for all air travelers. And for families traveling with children under the age of 12, the children will now have a limited release from quarantine. This means they can accompany their parent or guardian to their destination, so long as they avoid group settings like summer camps, school, or childcare for 14 days. After August 9th, we're also permitting international passenger flights to Canada to land at 5 additional Canadian airports: Halifax, Quebec City, Ottawa, Winnipeg, and Edmonton. Earlier this month, we removed the requirement for airlines to perform pre-departure temperature screening of international air passengers coming to Canada. With the public health situation improving, we're also eliminating pre-departure temperature screening for domestic air passengers and passengers departing Canada on international flights, as well as for airport workers. The temperature screening requirements will be fully eliminated as of August 9th. I also want to stress that there are still necessary public health measures that remain in effect, as you said, Madam Crombie, including wearing masks at airports and on board all flights to, from, and within Canada. And all passengers, vaccinated or not, must still present a negative COVID-19 test result before boarding a flight to Canada. I also announced earlier this week that based on public health advice, the restriction on direct commercial and private passenger flights to Canada from India is being extended for another 30 days until August 21st. This extension will best protect Canadians from an increased introduction of the Delta variant, which is prevalent in India. As a reminder, passengers who depart from India for Canada via an indirect route must still obtain a valid COVID-19 test result from a third country before boarding a flight to Canada. In order to take advantage of the ability to resume international travel, it is crucial for travelers to properly demonstrate that they are fully vaccinated according to Canadian standards. Starting August 9th, air carriers will begin verifying that travelers coming to Canada have submitted their COVID-19 information digitally through the ArriveCan app or website before boarding a flight. This includes information and documentation to demonstrate that they are fully vaccinated. This will apply first to U.S. citizens and U.S. permanent residents who travel to Canada for discretionary purposes on or after August 9th. On September 7th, foreign nationals from other countries will be permitted to come to Canada for discretionary purposes, and they will also need to provide proof that they have been fully vaccinated according to Canadian standards. Without this proof of vaccination submitted in advance through ArriveCan, foreign nationals traveling for non-essential purposes will not be allowed to board a flight to Canada. All of the travel and transportation measures that have been put in place because of the global pandemic are based on available data, scientific evidence, and the evolving situation in Canada and outside of our borders. This is also true for the decisions to adjust these measures. The health and safety of Canadians will always be our first and most important priority. I want to thank Canadians who've waited patiently as we carefully and gradually remove transportation and travel restrictions. I also want to thank the airlines, airports, and everyone who works in the aviation sector. The sector has endured a lot during the pandemic. Our government has been there to support airline and airports, but nothing beats working together to restart travel. I ask travelers as well to be patient during this transitional time. As volumes ramp up, there might be longer wait times than usual as airports adjust to the new reality. The global pandemic is not over yet. We need to remain vigilant and cautious. We don't want to squander the hard-won gains made by Canadians, as Dr. Lowe has said. So, in closing, Madam Mayor, I just want to, again, repeat what you said earlier to thank the people of Mississauga, to thank the City of Mississauga, to thank the council, you, Madam Mayor, and staff at the City for welcoming the First Nations of Kate Lake and helping in the efforts to evacuate them. Many of our communities are enduring difficult circumstances today because of these fires. So thank you to the people of Mississauga for stepping up. I also want to thank Dr. Lowe, his team, and the folks at Public Health of the Region of Peel. I want to thank first responders and frontline workers. And I want to thank, again, the Region of Peel, its council, the City of Mississauga, its council, you, Madam Mayor. I also want to thank the people of Mississauga for stepping up and getting vaccinated. We are demonstrating impressive numbers, but as Dr. Lowe said, and as you said, Madam Mayor, we are not there yet, so we need to keep up the momentum. So please, please go get vaccinated. Vaccination is an important way out of this pandemic. Thank you very much for giving me the chance to be with you today. I apologize for not being able to stick around for the questions, but my office will be more than happy to respond to questions anybody has later on. Thank you very much.
And thank you to you, Minister Alghabra, for providing those clarifications and for the great work you are doing on behalf of Canadians and, of course, your Mississauga residents. I think residents will be very grateful for the clarity in the guidelines, and it is certainly progress. Unfortunately, as Minister Alghabra has said, he has to leave, so he won't be joining us for questions, but we can note them and get you responses from his office. But along with Dr. Lowe and Chief Rizzi, we are all here and ready to take questions from the media.
Mayor Crombie, your first question comes from Shauna Hunt from City News. Go ahead, Shauna.
Hey, good morning there. My question is actually for Dr. Lowe, if you don't mind.
Yeah, no problem, and welcome, Shauna. Thanks for joining us. Here he comes.
Dr. Lowe, so for teenagers to be fully vaccinated by the start of school, they need to get their second dose by August 24th. So that leaves, a 5 or 6 day window right now for that age group, the 12 to 17-year-olds, to get their first shot. How many in that age group still need to get their first vaccine?
Yeah, thanks, Shauna, for the question. At this point in time in our 12 to 17 age group, we're over 64% with one dose. So that means there are about a third that are still needing to get their first dose. And it's for that reason that we have launched Vax to School. Again, yesterday and today, youth 12 to 17 with proof of age can come to the front of their line together with their families to be prioritized for vaccination. And then throughout the next week or so, there are a number of youth-focused clinics and appointments, specific clinics that have been reserved for youth, and that's available on our website at peelregion.ca/COVID-19 vaccine or on the Region of Peel's Twitter.
Follow-up, Shauna?
Yeah, sure. So, just a quick follow-up for you. 12 years and up, they've been eligible, that age group they've had, the 12 years and up have had eligibility for a while now. Why do you think that there are still so many teens that are unvaccinated? Are we seeing hesitancy in this age group?
It's a good question, Shauna. Certainly, there are lots of reasons why this age group may not have been vaccinated yet. Certainly, it is the summer, so overall, we're seeing volumes go down, which is why actually my overall push in my remarks today is, summer's great, but fall is coming. We know we're going to be going back indoors. We don't want to waste the progress we've made, and we really want to push our vaccine coverage as high as possible, which is why my message today is for everyone to try to access 2 specific doses. But certainly with 12 to 17s, as with anything else, I imagine they may have questions, their families may have questions. So I encourage anyone with questions to speak to their family, to speak to their friends, to visit the website peelregion.ca/COVID-19 vaccine. And then especially if you're seized with getting your vaccine, to take advantage of the Vax to School Fast Pass to get to the front of the line today, or any of the youth focus clinics coming up in the next week. Thanks so much for the question.
Next question, please.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Mayor Crombie, how are you?
I'm very well, Steve. How about you?
I'm quite well. My questions are actually for Dr. Lowe today.
No problem.
Well.
Thanks for joining us. I'll bring
Thank
them on.
you. Dr. Lowe, just a question about the 12 to 17 age group as well. I guess if that rate, they're currently about 40% of those 12 to 17 are double vaccinated. If that rate doesn't get closer to 75% or reach 75% by the start of school, will that impact your thoughts on whether or not these youth should return to in-person classes?
No, I think the aim is to return them to in-person classes irrespective of the rate. I am very confident that we will see high rates of vaccination in this group, especially with our push here with Vax to School. Really encouraging everyone. I think vaccination is one toolkit, one very big foundation in our toolkit in terms of keeping in-person learning safe. But we know, Steve, last year that we were also able to keep in-person learning safe through certain measures, and that the Ontario Science Table, as outlined in Mayor Crombie's remarks, has also proposed specific measures that would be considered in schools to ensure the safety of in-person learning, and that there may be other measures considered depending on what the patterns of COVID-19 transmission look like in September and through the fall.
And a follow-up for you, Dr. Lowe. You talked earlier on about an anticipated surge in the fall. Can you take us through why that you're anticipating that, or what's indicating that there will be more cases in the fall?
Absolutely, Steve. I think there's we know that COVID-19 is a respiratory virus, and there is usually, especially as you move indoors in the colder weather, more close contact, more opportunities for droplets and aerosols to spread. So there is that recognition that it is entirely possible in the fall that you will see a resurgence. However, the whole point of the vaccination is both to attenuate and minimize any transmission from person to person, and then also ensuring that if an individual is exposed to COVID-19, the course of illness is mild and does not result in severe outcomes such as hospitalizations, death, or chronic illness. Thanks so much for the question.
Next question, please.
Your final question comes from Natasha O'Neill at The Pointer.
Good morning, Mayor Crombie.
Welcome, Natasha. Thank you.
MP Algaba arrived at the press conference today, made an announcement, appeared on TV, but he did not take any questions from the media. Are you concerned that the MP, who has taken a lot to say over transportation requests, is taking Mississauga for granted?
Oh, not at all. Minister Algaba is a very dedicated member, and unfortunately, there are always benefits and costs when you have a minister representing your community, because of course now they have a larger national role. But his office is very dedicated and always responds to local residents as well. And unfortunately, as you heard, he is traveling and so unable to attend. And of course, he probably has many appointments and many engagements and unable to take questions. I am happy to try to field them or certainly pass them on to his office, Natasha.
We will reach out to his office. Thank you.
Thank you. Sorry about that.
My next question. That's okay. My next question will be for Dr. Lowe.
Perfect. Thank you, Natasha.
Go ahead, Natasha.
So vacancy rates for nurses are rising in Manitoba, peaking at 25%, and in Quebec as well. Do you know the vacancy rates in Peel, and are you at all concerned?
Thanks for the question, Natasha. I believe if you're speaking to sort of health workforce information, healthcare workforce system information, that question would be better directed to Ontario Health Central Region, which oversees the healthcare system. I can speak just generally, and we do know that vacancy rates, or we do know that overall all professionals throughout the pandemic have faced a significant burden and pressure. Our frontline providers, the things that people have had to endure with families in ICUs and hospitals, even our public health staff, our public health staff that have been out working in mass vaccination clinics. I've talked long and at length about the abuse and harassment that some of our staff have faced as contact tracers, as outbreak investigators, as public health inspectors. So it has been a difficult pandemic, I think, for many frontline providers. And while I don't have the statistic, I would encourage you to reach to the Ontario Health Central Region to ask their health workforce folks to look at the data there. I do want to say, and this is a good reminder, I was remiss in my remarks, that I do also want to really highlight and thank the tremendous work of Peel Public Health staff, our mass vaccination staff, our hospital providers, our primary care and community physicians, home care, long-term care. There is literally an entire healthcare system that has been through the ringer on this pandemic, and especially so, it does concern me where you have people who say that COVID is a conspiracy, COVID is a fraud, when these people have lived day in and day out, sacrificing together with, and I'm be remiss as well if I didn't mention our first responders, our police, our ambulance, our fire. We've all seen it, and we've all experienced this, and we understand what impact this has had on so many lives and so many lives lost and so many families changed in our community. So I think your question is a valid one. I don't have the data, but I do know from the experience that many of us have actually endured a really unprecedented response that I hope we'll never see again in our life, and that I hope we'll be able to keep under control in the fall if there is a resurgence, to really ensure that many of these fatigued and workers, many of whom have given so much and almost everything essentially to keep the community safe, that we are all as a community able to wrap our arms around everyone and just make sure that we get vaccinated and get out of the acute phase of the pandemic. Thanks for the question.
Next question, please.
That was the final question for today, Mayor Crombie.
Great, thank you. Thank you, everyone, for joining us, and have a great summer.